My name is Nicole Wong, and this is my presentation on later school start times and how its effects on teen mental health. This article listed explains adolescents naturally have different sleep schedules than adults because of biological changes that occur during puberty. Most teenagers naturally fall asleep later at night and need more sleep than adults. So some of our key ideas is how lack of sleep is linked to a lot of mental health issues that a lot of teens experience, as well as lack of sleep can lead to poor academic performance in a lot of students. And so later start times have been associated with good mental health in these students and better academic achievements. Our article states that sleep deprivation is associated with higher levels of anxiety, depression, difficulty concentrating, and poor academic performance. Experts recommended that middle and high schoolers start no later than 8:30 a.m. to better align with adolescent sleep patterns. Research suggests that later start times can improve student health and academic success. Some of the things that I found interesting. What I found interesting was how many areas of a student's life that can be affected by school start times. I know that sleep is important, but I didn't realize that changing the start of the school day could improve attendance rates, mental health, and even student safety. Some studies mentioned in the article found that students with lower start times got more sleep each night and reported lower levels of depression and anxiety. Other surprising findings was some communities experienced fewer car accidents involving teen drivers after delaying school start times in the morning. This shows that school schedules can influence health outcomes beyond the classroom and affects more than just students. Evidence and data used. A strength of the article is that it is supported by scientific research rather than simply the author's opinion. The article references studies conducted by sleep researchers and public health experts. Many studies were longitudinal studies, meaning researchers followed groups of students over time and measured outcomes before and after the times changed. Researchers collected information on the sleep times, attendance, mental health symptoms, and academic performance and grades. This type of evidence is considered stronger than personal opinions and makes this article really important to the topic. Problems and possible bias. Although the article provides strong evidence supporting later school times, there are some limitations. The article primarily focuses on the benefits and spends less time on potential challenges that would be involved with changing this for the better outcome of these students. For example, changing school schedules can affect transportation systems, bus schedules, after-school activities, sports, and a lot of students hold jobs, so that would also affect their hours and their work as well. These factors mean that later start times might not be very easy and might be more than just affecting sleep and disrupting daily lives. Because the article strongly suggests later start times, there might be some bias towards that finding. What hasn't been answered? This article that we covered answers many important questions overall, but there are still some areas that need further research. One question is, how expensive would it be for school districts to change transportation and scheduling systems? Another question is whether later start times benefit all communities equally. Researchers also need to continue studying the long-term effects on mental health. Finally, the article does not fully address how much sleep deprivation is caused by school schedules compared to factors such as smartphones, social media, and screen time before bed as well that also can affect REM sleep. Additional research can help answer these questions. Importance to this course in public health in general. This topic covers major important themes and chapters in this class. It relates to several topics we've discussed. Mental health is a major public health issue, especially among teenagers and young adults. The article demonstrates how environmental and policy decisions can affect health outcomes for the entire population, rather than just focusing on treating anxiety or depression as they occur. Later school might represent a primary prevention strategy talked about in this course that may help reduce the problems before they develop. This is an example of a health promotion that also seeks to improve the health of the entire group of people. The article also demonstrates how public policy decisions can have significant effects on community health as well, not just the targeted demographic. Thank you so much for listening. In summary, the article argues that The article argues that later school start times can improve sleep, mental health, attendance, and overall well being among teenagers and students. Although there are some challenges and unanswered questions, the evidence overall suggests that later start times might be an effective public health strategy for supporting student health and academics as well. And I'd be happy to answer any questions. Thank you so much.